All right, everyone. So today we're going to talk about early intervention, special education. As you know, I'm a developmental pediatrician at Luke's. I just want to highlight what I am not. I am not an educator. I am not a special education attorney. I don't work for health and welfare. So there's a lot of information here, and I think hopefully everybody can lend their expertise and share after my slides if there's more to add, because I think there's so much that we can all share together. So, okay, next slide. We will learn today how to increase basic knowledge of special education law. We'll summarize how to make an early intervention referral and guide early childhood education transition, increase our familiarity with the IEP processes, and hopefully all of you can develop an approach to inform parents and advocate for your patients. So this is a timeline of human brain development. So along the x-axis, you see age, and along the y-axis, you see synaptogenesis. And I think what I want to highlight here on this slide is how much brain development is going on in the early years of life, right? And really, it peaks between the ages of 2 and 3 years old, which is exactly the age, right, that we are assessing children through this program and diagnosing with autism and referring them to services. So we have a lot of opportunity, right, to help children early on and make a difference. And so keep this image in mind as you assess children and make these recommendations. The earlier, the better. Next slide. So what's available? So early intervention, right? In Idaho, it's known as the infant toddler program. In other states, they call it something different, but this is a program for children 0 to 3 years old. And children, they'll have an IFSP, or an individualized family service plan, that summarizes their supports, therapies, and services. When a child turns 3, this program ends, and then they can transition to an early childhood education program through the public school district, and they will have an IEP. This is going to be for children who are 3 to 5 years old, so prior to starting kindergarten. Beyond that, they can start kindergarten, continues a special education program, and they will continue to have an individualized education plan. Next slide. There is a lot of federal legislation, right, that protects children with disabilities, adults with disabilities. So prior to 1975, schools had the unilateral authority to exclude disabled students. So they could say that this child we cannot educate, so we are not going to serve this child in the public school district. So in 1964, we had the Civil Rights Act, right? And in 1973, this is when Section 504 of the Rehabilitation Act was passed. This was a landmark civil rights and labor law which prohibited discrimination against race, color, sex, national origin. In 1975, the Education of Handicapped Children's Act was passed. This was a Bill of Rights that guaranteed a free and appropriate education, so we call that FAAP or FAPE, to handicapped children 5 to 18 years of age. So a little story. So my mom actually graduated college in 1975. She went on to get her special education teaching certificate. On their certificate, she was certified to teach 2 types of students. It said a TMH student and an EMH student, which stood for a trainable mentally handicapped student and an educable mentally handicapped student. And so there wasn't a lot of guidance, right? And there wasn't a lot of curricula available to help support children in the special education system. And so what ended up happening was a lot of students were kind of schools were trying to include them into the general education setting, and they were putting them into, let's say, PE or music or art class, right? But they really didn't have a lot of resources and help kind of guiding how to really include them in the general education setting and provide them with a quality education. So in 1977, they then extended the age range, and it included kids from 3 to 21 years of age. And again, that 3 to 5 year age was optional. And it wasn't until 1986 when the Handicapped Children's Protection Act came out, and this extended supports for children 0 to 3 years old. So this is what we now know as the infant toddler program. Next slide. Okay, so in 1990, we have the Americans with Disabilities Act. 1990, we also had IDEA. So this is the Individuals with Disabilities Education Act. And Part C, which is known as the infant toddler program, is what we're going to talk a lot about today. In 1997, IDEA was amended, and this is when we were able to introduce positive behavioral interventions and supports through IEPs and a whole school approach. In 2004, this is when we introduced functional behavioral assessments and behavioral intervention plans in school. And in 2008, we had the ADA Amendment Act, which really widened the coverage of disabilities. One thing to keep in mind is many of these laws, this is like the floor. This is like the baseline of what we should be providing. really, as parents, as providers, as teachers, we should really strive to go kind of beyond what the minimum requirements are and really help and serve and educate students. Next slide. So we're going to talk about early intervention programs. So again, it's the infant toddler program. This is part C of IDEA for children 0 to 3 years. Keep in mind their philosophy is providing services and supports in the natural environment. So this is why a lot of the therapy that we see occurs in the home environment and not a center-based. There's not a center-based approach. Next slide. So what does the law require as far as an infant toddler program or early intervention? So states must offer an early intervention program for children birth to 36 months who have an established disability who are considered at risk for disability. The type and content of services are determined and summarized in the child's IFSP, right, the Individualized Family Service Plan, and specific services must be offered, and we'll go over what that might look like in a few slides. Next slide. So early intervention. Programs are available in every state and territory, including Guam, Puerto Rico, the U.S. Virgin Islands. They're publicly funded programs. So they provide free services or at a reduced cost for a child who is deemed eligible. You do not need a doctor's referral or primary care provider referral. This can be done through, a parent can ask for a referral, a neighbor, grandparent, anybody. And eligibility is based on an evaluation, and then they determine if the child qualifies. Next slide. This is what it would look like if you were to put in a referral to the infant toddler program. Well, hopefully many of you have already done this. There's an online referral form, so there's a picture to the right. There's also an email that you can use, phone number, fax number, etc. So it's pretty simple to just submit a referral to the infant toddler program. Next slide. So what does it look like upon receipt of the referral? So they will then undergo a screening. So the infant toddler program or an early intervention program will contact the family and they will conduct a screening to determine if an evaluation is warranted, okay? Then they will do an evaluation to determine eligibility. If a child is not deemed eligible, the goal is to still connect the family with community resources. If they are eligible, then it is the duty of the infant toddler program to develop an IFSP within 45 days of the referral. Okay, so there are some legal time parameters here, right, that need to be followed. And then services need to be initiated within 30 days after the IFSP is signed by parents. Every 6 months, they're eligible for an IFSP review, and then every year they can develop a new IFSP. Many of the children that we see that we are referring for the infant toddler program are not really getting into the program until after they're 2 years old, so they may not have an annual review. So they end up kind of aging out. So at any time, when they do these reviews, a child may no longer, they kind of may graduate from services or may no longer be deemed eligible. They will then be transferred to community resources. Or if the child stays in the program until they're age 3, they will then transition to Part B, right? That's going to be an early childhood education program through the school district. And we'll talk about transition in a second. Now, for some children, if they're born over the summer, there ends up being a gap in service delivery, right? So if they're a June birthday, a July birthday, in some states, so I'm actually from Illinois, children who are born in the month of May actually can be eligible for extended services, so an extended IFSP, so they can continue to receive speech therapy, occupational therapy through the summer, right, through the infant toddler program or through early intervention, and then transition to the school district in the fall. And that's if they are deemed eligible for an early childhood program when they're evaluated in May. So there are some really nice, there are some nice things that we could advocate for, right, to help to make sure that these children don't have a gap in services. Next slide. So what's the eligibility criteria for an early intervention program? So you have to have significant delay, 30% below age norms or 6 months behind other children the same age. And they look at the 5 areas of development. So I listed the 5 domains here, very similar to what we're all screening for in our clinics. Or a child has a physical or mental condition, an established condition, an existing condition that would likely result in a developmental delay, so such as Down syndrome, hearing and vision deficit, cerebral palsy, cleft lip, etc. Next slide. Here are some of the services. So all families will be assigned a service coordinator, and this individual will kind of help develop the IFSP and help kind of organize services for this family. And they play a key role in the transition process. So transitioning the child out of the infant toddler program to an early childhood program. Next slide. So what does that look like? So by law, early intervention services will end when a child turns 3. And I usually tell families this is a hard stop. You don't get any windows, an extra week or 2 or anything like that. It is on your child's birthday. So we really need to be prepared for that transition. So between the ages of 2 years and 3 months, so 27 months, and 2 years, 9 months, 33 months, the IFSP will be shared to the school, will be shared with the school district. We'll start that transition process, right? And a transition plan will be written, and then they will have a conference to kind of discuss the transition. So it's really important for families to understand that this is something that can start prior to their third birthday, several months prior to their third birthday. You don't have to wait until the child turns 3 in order to start this process. Next slide. So there are other programs available. So the Idaho Head Start Association, so includes Head Start, Early Head Start, Migrant Head Start, Native American Head Start. They really focus on school readiness, and 10% of their enrollment must be children with disabilities. So I have a lot of children with autism who may not qualify for an early childhood program or even infant toddler program. They have, they may be level 1 autism, level 2 autism, and they just don't meet the minimum requirements. And so Head Start is a wonderful opportunity for families to still receive resources, services, and supports for their child in the community. So I put the website in both the general website and then also how to enroll. So eligibility for Head Start. So families have to be below the poverty guidelines. Many of them may be receiving public assistance. So those are some listed. Experiencing homelessness, children who are in foster care would qualify, or those who are disabled or have a serious health or mental health condition. Next slide. The maternal infant early childhood home visiting program is another option for families. So they use evidence-based home visiting models, such as parents as teachers. So this is where they'll send a parent to parent home, individual home, and kind of provide personal in-person visits. Group connections in the community. They provide health, hearing, vision, developmental screenings for children, and they'll link or connect families with other resources in the community. They also use nurse-family partnerships. So this program focuses on first-time mothers. And one thing to keep in mind that if you're referring a mother to this program, they have to enroll in this program prior to the 29th week of pregnancy. So it needs to be during their pregnancy when they start this program. And then the image on the right just shows kind of the distribution and where most of the participants are across the state of Idaho who are in this program. Okay, next slide. Idaho STARS has some really wonderful resources for families as well. They have a child care resource center with just a ton of supports available. They provide professional development system for early childhood providers. They will also help link families to child care centers. And so the Idaho Child Care Program will offer families, if they qualify, tuition assistance for childcare. So again, for some of our kiddos who may not qualify for the traditional early childhood program or infant toddler program, these are just additional resources that parents can explore to allow their child early intervention supports. Next slide. Learn the Science Act Early. So this is backed by the Centers by CDC and the National Center on Birth Defects and Developmental Disabilities in partnership with the American Academy of Pediatrics. It's a wonderful program. It aims to improve early identification of developmental delays, including autism. Most states will have an Act Early program. We do here in Idaho. Noreen Womack is one of the leads in this project, and they have a wonderful newsletter. So I encourage families to access resources through their website as well as providers if you want to learn more. Next slide. Birth to 5, Watch Me Thrive. Another wonderful program. This is from the U.S. Department of Human Health and Services and Health and Human Services and the U.S. Department of Education. So another great resource to help celebrate developmental milestones, promote universal and developmental screening, and really provide families with a lot of great resources. They have partnered with the Help Me Grow National Center. Help Me Grow they have some really wonderful typical developmental videos that I like to share with learners who come to my clinic, medical students, residents, fellows. So some really wonderful resources. They're great for parents too. So I encourage you to kind of check out their website. Next slide. I thought this was a really cool resource they have. It's a free download or free printout. It's a developmental screening passport. So it really encourages parents to be engaged in their child's developmental screening and surveillance. So what it does is it allows them to kind of keep track. A lot of times we screen kids and, the questionnaires or ASQ or MCHATs get buried into the medical record. I think it's important for parents to understand why we're using these tools. And this is a way that they can kind of help keep track. It might be a nice, useful tool to kind of share with the school district when they do start preschool. Next slide. Idaho Parents Unlimited, wonderful program. They'll help families, they'll kind of assist them with advocacy. They don't actually go to schools and provide. I think that's what a lot of parents think, is that they're going to come to schools and attend IEP meetings. They do not do that, but they do offer a lot of training workshops for parents to help with school advocacy, and really empower parents to kind of through this process. There's a lot of education. There's a lot of learning that goes into understanding, these different programs that kind of are available for families. And special education is really confusing sometimes. So this is a really great resource for parents to learn more. Practice changes. So refer children who are at risk. Don't wait and see or give them time. I think it's really important. We know early supports, early intervention make a big difference for children with autism and developmental delays, but really for all children who may be at risk. It's okay to over-refer. If a child doesn't qualify, that's okay. At least then and you have some data to support why they didn't qualify. Advocate for your patients and follow up. So review the progress reports, the IFSP if you can get a hold of it, or any other diagnostic reports. Treat early intervention, early childhood education programs as like a subspecialist, right? So if we refer to a cardiologist, we're absolutely going to read the consult note, right? We're going to find out what is the murmur, right? What's going on. And so I think use this as almost like a consult service. Review the reports and then document it in the medical record. Next slide. So talk a little bit about early childhood education programs or developmental preschools. So this is under Part B of IDEA, and this is for children 3 to 5 years old. The philosophy here is keeping kids in the least restricted learning environment. Next slide. So there is an enrollment process for early childhood education programs. It starts with a developmental screening. So they're going to look at the different areas of development and learning. They'll complete a comprehensive assessment, determine eligibility, and then determine placement. So for our kiddos who are starting an early childhood program or developmental preschool, there are different classroom placement options for them. And so they will try to find the most appropriate classroom setting for that child. I put the phone numbers on there for both the Boise School District, West Ada School District. It's really easy to just call and schedule an early childhood evaluation. Next slide. Our collaboration with schools is so important. It takes a village for these kiddos, right? We always talk about how these kiddos have a team, right? And it's across multiple different disciplines, the educational system, private therapies, the medical system, and you as a healthcare provider are very much should be engaged in the educational community. Your reports, which will document, their surveillance and screening you've done over time, will be shared with the school districts. That can really help guide educators in developing an IEP. Referrals. So if you're documenting in your notes a referral to neuropsychology for this, and this, that's going to be helpful for the school to understand why. Any other referrals that you make for speech, PT, OT, all of that, right, are going to be helpful for the school. Just advocacy in general can make a really big difference for these families. Next slide. I tell families that school is the workplace for children. So children are at school more than I'm at the hospital working. Seriously. So it's like amazing how much time they spend there. And it's an important part of their life. And so it is, and really a successful school experience, a positive school experience has really tremendous impacts on psychological and social growth. Next slide. So just to review, there are 2 umbrellas that protect children with students with disabilities. So there's IDEA. So this protects students with disabilities who will require special instruction in the school district, or related services. Related services include the therapies that we talked about, speech, OT, PT. It's definitely more hands-on than Section 504. Section 504 is the civil rights law. This protects students with disabilities who will require accommodations, not necessarily specialized instructions and modifications to curriculum. This is a little bit more hands-off, and Section 504 is monitored by the Office of Civil Rights. Next slide. So this Venn diagram shows kind of where IEPs and 504 plans overlap. So both plans will have accommodations and modifications to the school environment, and provide different classroom materials that will optimize the child's learning experience. So remember, an IEP is going to be special education services, okay, and a 504 plan is going to be more of the accommodations in the classroom setting, and those could be physical accommodations and educational accommodations. So think about our kids who have ADHD, who get preferential seating or extended time for tests, right? We're not necessarily changing the curriculum for them. We're just providing them a different environment, again, to optimize their learning. Next slide. I like this kind of algorithm or roadmap. It really helps understand, the thought process of what a school district will be going through when they identify a child who has a need potentially for special education or for accommodations. And the goal, right, to get from pink to pink is our goal is to get to the free and appropriate public education, right? And so these are kind of two ways. On the left side, you see kids who are going to their thought process is to develop an IEP, and on the right, it's a thought process on how to develop their 504 plan. Next slide. So just a review of some statistics. So the number of students ages 3 to 21 served under IDEA went from 6.4 million in 2012 to 7.5 million in 2022. So we went from 13% to 15%. So the National Center for Education and Statistics is a great resource if you ever want to look up data on this. Next slide. This is a map of, and what it shows is the percentage of students who are enrolled in the public school, the percentage of students who are served under IDEA. So they have an IEP and they receive special education. So the average, as I mentioned, is 15%. And so it varies from state to state. We're at 12% in Idaho, which, makes us believe that we can do better, right? That we may not be identifying all the students who would be eligible to receive special education under IDEA. So not great, but I think there's always room for improvement and advocacy. Next slide. Just to review some terms. So IDEA, Individuals with Disabilities Act, FAAP or FAP, Free and Appropriate Public Education, LRE, so Least Restrictive Environment. This means children should be placed in an environment which maximizes their time in general education as much as possible with accommodations and supports. Some families who have children with autism will come and they will want me to write a letter stating that their child should be in the general education setting, and they want a paraprofessional one-on-one. And sometimes I tell families this might not be the best option for your child. I know the goal is LRE, least restrictive environment, but sometimes being in a general education setting with a one-to-one aide could be more restricting than if the child was in a resource room, small group, with a lower ratio, right, teacher-student ratio. So I guide parents through this because I think many of them want their child to be included as much as possible in general education. But again, that might not be the most appropriate educational setting for them. And then, of course, IEP, Individualized Education Program. But it's not just a program, it's a plan and a process as well. Next slide. There are 6 principles of IDEA. So we talked earlier about zero reject. Schools can no longer deny a child a public education based on their disability. They need to provide testing, classification, and placement. Again, free and appropriate public education, least restrictive environment. Families are entitled to procedural safeguards, so they have rights and they have a right to due process if they disagree with the school's decision. And then, of course, parent participation, shared decision-making is always encouraged. Next slide. A school will ask 3 questions to determine if a child is eligible for special education. So 1, does the student have a disability? 2, does the disability negatively impact the student's educational progress? And 3, does the student require special instruction or related services beyond what is available in the general education program to make progress? So just because a child has a disability, and as a provider, we're writing that disability in a report and giving it to the school, does not automatically mean that they qualify for special education. These 3 questions have to be answered yes. Next question, or next slide. Okay, so there are 14 different educational eligibilities that schools can choose from. There are 70,000 or more ICD-10 codes, right? So we're very narrowed here in kind of how we can classify a child's special education eligibility. So the ones we'll deal with the most, especially in this age group, are autism and developmental delay. There is at the bottom, there's a link to the Idaho eligibility category quick guide, which is really nice. So you can kind of look at all these eligibilities and kind of, what the qualifications are for each one. Language is very important here. So children are not diagnosed in schools. They're made eligible for special education. So it is not a diagnosis. Many times families will take the IEP and they will try to get services. They'll say, no, my child was diagnosed with autism at school. And that does not, insurance companies will not honor that. They will not cover ABA, and they will not be reimbursed if it is only completed by the school. They will need a medical diagnosis, which is where everybody here comes in to play. Next slide. So the autism spectrum disorder eligibility. So school psychologists can identify or classify a child with an educational eligibility of autism within the school context. Like I said, it is not a medical diagnosis. Usually it is based on the DSM-5 criteria, although other schools can add kind of additional stipulations. In the state of Idaho, they have required team members. So if they are going to assess a child for autism and they're looking at that eligibility, a school psychologist and a speech and language pathologist needs to be on that IEP team. Okay. School districts must consider private evaluations. So our providers, right, who are participating in the STAT training, your notes will go to schools and they will review them as part of the IEP process. Schools can suggest a medical evaluation for kids that they think that are at high risk. Schools, if a parent then pursues what we call an independent educational evaluation, schools may have to pay for that, right? So if they're recommending a family to get a full evaluation, they may actually be held responsible for payment of that evaluation. And there are requirements as to what is considered an independent educational evaluation. Next slide. Developmental delay is the other major eligibility that we'll be looking at. So this is for students who are ages 3 to 9 during the year that the IEP is in effect. Beyond age 9, we cannot use developmental delay as an eligibility. It needs, children are then kind of reclassified. So either intellectual disability, speech and language impairment, autism sometimes. So this is more of an eligibility of elementary school, early childhood. It is used for students who do not have a clear diagnosis. If a child does have a diagnosis, as I mentioned, it's best to kind of match that diagnosis to the appropriate eligibility. Next slide. There are a lot of benefits to early intervention. Outcomes, it's amazing. So increased IQ of approximately 8 points. Great effects are those for children who are at high risk for psychosocial challenges. There's a decreased use in special education of 5 to 25%, decreased grade retention of 10 to 15%, and there's definitely higher graduation rates as well. There's two great, really revolutionary studies that were conducted in the 60s and 70s, and I don't have time to review those today, but I encourage you all to look them up. The Carolina ABCDarian project and the Perry Preschool project, what they did was they enrolled students into high risk kind of young children into early childhood education programs, and over time they have now monitored decades now, and the results are just amazing. Better health benefits, so lower rates of hypertension in adult males, increased graduation rates for women, higher earnings as adults. So really wonderful. But those are two great studies that I highly recommend if you're interested to look them up. Next slide. So the Developing Child out of Harvard has some really excellent resources. I love this video. We don't have time to watch it today, but I encourage you all to Google it. Every learner that comes in my clinic, I encourage them to watch it because it really shows how important early intervention is and what we can do as a community, right? We have to work together to support children, and then and just the outcomes are wonderful. So thank you, guys.
Great, we have a couple of minutes. Let's open to questions. Thank you, Amy. You can unmute, or if you want to put that in the chat, you could do that as well.
Hi, this is
Thank
Dr.
you for all the.
Oh, go ahead.
Oh, I was just saying thank you for all the comments, Julie and Elena. Sorry I couldn't keep up with us.
So I frequently experience referring kids to infant toddler program where there's absolutely a delay in their initial evaluation, and more specifically, a delay in starting treatment and care. A lot of it's just due to staffing through infant toddler program. Is there any recourse to that besides just saying, okay, now I'm going to send you to, your favorite speech therapist or occupational therapist when they don't have access through infant toddler program?
Brian, I deal with the same exact things. And the feedback I hear from parents is exactly that. We're on a wait list, or, there's no providers available in our area.
Or we're seeing the physical therapist for our speech delay because that's all that we can see.
Well, yeah, different states have different approaches to providing early intervention. And if there's any early intervention providers on, please jump in. I'm happy to listen to you too. Idaho supports more of a coaching model from what I gather. So one individual from the from the IFSP team, right, will represent and kind of meet with the parent and work with the child. So sometimes when I talk to parents and interview them, I'm not sure what service they're actually getting, and they're not sure either. Sometimes they say, well, a developmental specialist comes to my house twice a month and works with me, and but I'm not sure if they're a speech therapist. So I encourage them to ask questions, right, and find out, who are you working with and what are they working on. It's a different model of service delivery in other states. I'm from Illinois, so I'm used to Illinois. And in that program, children, especially the children that we're seeing, they are typically getting speech therapy, occupational therapy, developmental therapy, sometimes physical therapy weekly, right? And every week. And so I think it comes down to just resources, right? We don't have enough therapists to go around. So as far as repercussions, that's a great question. When there's nobody available, I don't think there's any like legal actions that parents can take. I'm not exactly sure. I'm not an attorney, but again, I just really support parents and try to advocate. And just like you said, I think then sometimes families access private services, right? In the community. So it's challenging.
Okay, thank you.
Yeah.
Can I add, Dr. Francis, a touch there? I think from this platform, educating the parents on what these licensures are and who these people are, and giving them direction to advocate into the system. I know folks who will become the squeaky wheel, and because they're becoming the squeaky wheel, they all of a sudden start getting services implemented within their world, where those who just say, okay, yes, and then wait the 6 months, 9 months, 12 months, 24 months, they continue to wait. And so I would really advocate strongly, and for our state and for the services that are available, the only way we know to add more services is to have those things be done, so that way we can recognize like we're needing more and more and more. Not that it's necessarily that hidden that we need more services and resources and people in the world, but I just have seen success with that process.
Travis, I second that. I have families who have tons of hours, tons of services. I don't know how they've moved here from other states and implemented that. And I'm like, wow. So it can happen, I think, with a lot of persistence, but it's unfortunate that it has to be that way. Yeah.
Well, thank you, Sarah. Fantastic case today. Amy, thank you so much for your presentation. I'm so glad we had some time for Q&A. I know this conversation, we always want to continue as much as we can. There's always more questions, but thank you for your time. So we are going to meet again on the 25th of July from 12:30 to 1:45 Mountain Time. The topic is family empowerment, exploring parent training options for autism support. And we are happy to have Karen Beers. She is a PhD and clinical director at Seattle Children's Autism Center, and also the associate professor at University of Washington. So Karen will be joining us for that presentation. A little plug, if you are part of cohort 1 or have colleagues in cohort 1, we have room for a patient case on the 25th, so you can help spread the word. If we don't have a case, bring your questions. We will have a free Q&A time. So a little bit to be determined on that, but we look forward to seeing you on the 25th of July. Thanks.